it is 500 milligrams of paracetamol, isn't it? And they can go, yeah, and you can go, excellent, another life saved.
Yeah.
Hello, welcome to the Coffee on Call Medicine podcast, a podcast series to help ease your transition from medical school to foundation. So sit back, put away the textbooks, and grab a coffee. Enjoy. Hi, welcome back to Coffee on Call, the Foundation Medicine podcast. I'm joined by Varun and Imi.
Hello.
How are you
Hello.
guys?
Yeah, not too bad, thanks. How are you?
Yeah, not bad, thank you. How are you, Imi?
Yeah, a little bit tired, a little bit sleepy.
How come?
I've just come off nights, that's why I look so dazzling.
No way. I do not look like this when I come off nights. Fair play. So the plan for this week is actually to discuss night shifts. So you've timed that really,
How
really well.
Great timing.
So you'll be able to tell us all about your experiences. So I guess one of the things I wanted to talk about was the feeling of like the anticipation of doing your first set of nights as an F1. I think it's quite a scary process and quite a scary prospect. So I wondered how did you guys find that?
Yeah, I think a lot of it is the uncertainty about what you're going to go into drives a lot of the fear. So for me, I started my first day as a standard day or a normal working day, 8 to 5, and then I went into night shifts as my second shift. I think I didn't know quite what I was supposed to cover. I didn't know like how the bleeps worked. I didn't know exactly how to reply to these bleeps. And there was a lot of apprehension. Also, the stuff about how do I get myself into nights? Will I be too tired to do the job that I need to do? All of those things sort of played into it. So yeah, it was quite nerve-wracking to begin with. Yeah,
I think it is worth remembering, like there was quite a lot of fear that you would start on nights. Because remember, about 20% of you are going to have to be on nights on that first Wednesday, and how you address that and how you go through it, because you will get through it. And it's not uncommon when you change jobs, when you rotate, to go from nights to days or days to nights and that kind of thing.
Definitely.
yeah,
And I think people going into it kind of feel that it's quite scary, isn't it? Because in the day there's loads of people around and the whole team are there, but then at night it kind of feels like you're the only. You have this feel like you might be the only doctor around.
yeah.
But it's not true, is it? Like when you, as you say, 20% of people are going to turn up and start on nights, but that means there's going to be loads of other people in the hospital at night. So there's quite a good team around.
Yeah, I think actually what you end up finding is you will find whatever works for you in terms of who you speak to and how you get yourself through the night shift. So for me personally, I was really lucky. I had a really helpful doctor who was just a bit more senior to me. And so they gave me their phone number and essentially just said, if you have any issues, you can let me know. And then one other thing that I was told about before I started the night shift, which I didn't really know about as a med student, was that there's always a team of other sort of professionals who work in dealing with unwell patients, something we call the critical care team. So if you needed to have some advice about going through what you would need to do to treat this patient who's quite unwell, you could give them a ring. And actually they became like a really useful source of help, over the night shift.
Did you have to do night shifts as a medical student?
I did, yeah. So often you were sent home early, I think, because people take pity on you and they go, go have fun while you can.
Yeah.
But certainly in my 5th year, when we had sort of more formal shadowing, I think my uni called it like a post-finals assistantship. It's quite common now.
Yeah.
I stayed the whole night because I think I didn't want my first night shift to be when I was responsible, as it were.
Yeah.
And I think you learn a lot by just watching the F1, who normally by that point in the year is fairly confident because they're coming up to the end of their F1, watching them do the job, answer the bleep, and you can ask them all those silly questions, like, what do you eat on nights? That's a big one I've had. Now we've got F1 starting. They've been asking me, well, what do you have for breakfast and when is your breakfast?
Yeah.
I don't know about your guys' thoughts on this.
Oh, the breakfast controversy.
This
So
is
when
a
you go
real
home,
challenge.
Yes, you go home from nights, it's 8:30, 9 a.m. Are you a breakfast at breakfast time or a dinner time at breakfast time kind of guy?
So initially I was a nothing, like I went home and I went straight to bed and I crashed, and then I realized actually this is probably not the right thing to do. So I ended up doing breakfast, so like a proper sort of like maybe cereal if I wasn't too hungry, or might have like some eggs or something like that.
I'm picturing you cooking a full fry up in your scrubs.
In my scrubs after 12 hours and just being like,
Varun
this is all I
would
need.
never commute home.
No, absolutely not.
Obviously not. Yeah. I don't know about you. What about you, Richard?
I'm a breakfast at breakfast time.
Yeah,
kind of
yeah,
guy.
yeah.
So I like to go home. I don't believe in this getting straight into bed thing when you go home. I feel like if you did a long day daytime, you'd do 8 a.m. to 8 p.m. and then you'd go home, make dinner, chill out, watch the TV, go to bed. Maybe I would probably go to bed like 11 o'clock, something like that. So I would apply the same to a night shift. So I get home at 8 a.m, 8:30, let's say. I'll make a cup of tea, have some crumpets or toast or something like that for some breakfast, and then I'll chill out and put something mind-numbing on the TV and just completely unwind. And then maybe 10:30, 11 in the morning, I'll go to bed, and then I'll get up at a more reasonable time in the evening. So I get up around 6, which is the equivalent of like 6 a.m.
Yeah.
Make my dinner and go to work.
See, I think I fit neither pattern. I make my own rules. So for starting a night shift, I'll get up at like maybe 5 p.m. Say if I was working at 8. And I'll have dinner for breakfast. So, because often for me at least, the first 4 or 5 hours of a night are quite busy because you get lots of people coming in for clerking, or depending on what you're covering.
Yeah.
So hang on, for the listeners who don't know, can you explain what you mean by people coming in for clerking?
Absolutely. So clerking is if a patient comes to hospital, they need a full assessment. So they need you to take a history, examination, order some investigations, interpret those and make a plan, basically. So it's kind of like your first MOT. And then they might be reviewed by a senior, they might be sent to a ward, that kind of thing. So you're sort of starting fresh, like you would an A&E or an acute assessment unit. But what you also get is sometimes people are sent directly to wards, depending on your trust. So you might be doing that initial assessment, but they've already got a bed in wherever it is that they are.
Okay.
Yeah.
So doing that kind of thing often means you're quite busy at the start. So I'll get up and I'll have a coffee, and then I'll have like, I don't know, stir fry for my breakfast.
Breakfast of champions.
Breakfast
Obviously.
of champions, indeed. Yeah.
Not unlike a student, pot noodle ready to go. And then
Never a wrong time to have a pot noodle. Is what I say.
of course.
Yeah.
And then when I get to work, I normally have coffee number 2. And then I try and take a break about 1, 2 in the morning. And that's like your absolute last coffee point for me if you want to sleep in the day. And I'll have lunch. So like maybe a sandwich. And then when I get in from work, I'll have cereal and go to bed. So I sort of flip my meals, but have them at roughly the same times, just in Australia.
Yeah,
So-
you're completely
Australia.
flipped around,
Yeah.
12 hours. I think also it also can depend on what kind of person you are in terms of, are you a morning person and are you a nights person? So for me, I've always been someone who sort of like functions better later in the day. I'm not an early morning person at all. So for me, I don't mind nights that much. Like the first sort of up until like 2 o'clock or something, I can sort of just go by almost in my own sort of time frame. Gets to about 4 or 5 o'clock, and that's when, you sort of start to get tired, as you would on any 12-hour shift. And so I end up sort of mixing my times of when I eat, depending on how I feel on that shift. So I might have it a little bit later if, for example, I had a pretty big first meal and then, push it on a little bit later. It really varies, to be honest. Yeah.
So you talked about being on call and being on nights, and you clock patients, make a plan, and then you need to get some help. So I wondered if you'd explain to us how would that work for you? So who would you be calling? Because obviously people might be quite scared that there might be them on their own at night. So can you explain a little bit about
now we are the
who you'd be
SHOs,
phoning
I can
for
assure you we're very scary. So normally whatever on-call shift, you're going to start with some form of handover, and that's a really good chance to meet your team. So you'll meet, your SHO, you'll meet your reg for the evening. Make sure you tell them your name, find out their names, find out how they like to be contacted. Is it their phone? Do they carry a reg phone? Do they have a bleep? What's the number of the bleep? Write it down. And then normally you escalate up the chain, but it depends. So for, if you had quite an unwell patient and you knew that your SHO, for example, was clerking in an assessment unit, you might be best off going straight to the registrar. Other times you might have, the registrar's taking the referrals, so go to the SHO. But to be honest, you can go anywhere up the chain. I think people won't mind. You might call me and I'll say, call a grown-up. That's above me.
We are grown-ups.
We are the grown-ups.
That's not happened yet. That's not happened yet.
Yeah,
So
I don't know about you. We were always kind of told or expected. It was expected that you'd go. They always say go up, not across. In the first instance, so you'd go up in your own team. So as you say, that maybe that's your senior doctor, so maybe your SHO or your registrar.
Yeah.
But then in certain circumstances, you might need specialist advice, and then you may go across. But I think it would be quite brave, really, to go directly for the specialist advice without asking your own team first.
Yeah, I would agree with that. And I think also it really varies on what kind of problem you're dealt with. So sometimes it might just be that you need another pair of hands and just another set of eyes to say, okay, what do you think about this patient's tummy? Or, what do you think about, this rash or whatever it is? And you can sort of problem solve together if this person is perhaps your level as well. So another SHO or another F1 for that matter. And then you can decide, okay, what is appropriate? Shall I escalate it up to a specialist advice or not?
Yeah.
Because I think that's the biggest thing with nights is that it's a lot of decision making by yourself, and you don't quite know if that decision is right or not. Because you've not done it before, so it's completely reasonable to get a second opinion.
That's how you learn, isn't it? I think I've learned the most from my long days and my nights.
Yeah,
because
definitely.
that's when
Completely agree.
Definitely.
you make the decision and you see the unwell patient.
Yeah.
And just piggybacking off what you said, Varun, certainly for your first nights as an F1, it's quite nice if there's another F1 working to kind of buddy up.
Yeah.
So Varun and I started on surgery together, and although we weren't directly paired, very sad.
Sadly.
Normally, it's quite nice to buddy up with the other F1, just to have
Definitely.
someone to sit with.
Yeah.
And then if you pick up a bleep and you're like, oh, I'm not really sure what to do about that, you can just say it to the person next to you or go, it is 500 milligrams of paracetamol, isn't it? And they can go, and you can go, excellent, another life saved.
For listeners, we would always suggest that you check any doses in the BNF. On your phone. Everyone should have the BNF on the phone.
BNF is 100%, one of the first things.
No, I definitely think that you're right. You learn absolutely loads on night shifts. I think that's probably the bit. I think that's probably where you start to feel like a real doctor,
proper
if that makes sense. So obviously, when you're at medical school, you can sometimes feel a little bit like a spare part, or maybe that you don't quite fit in and that sort of thing. And then as you start work, that I think that feeds into that anxiety feeling of that you're not going to be good enough, you're not going to be able to know what to do. But then when you start managing these patients and you start making some decisions overnight, that I think is when you start feeling like a doctor.
Correct, yeah. And I think definitely when you see the outcome of your decisions and you can see that, things went really well or things didn't quite go so well, then you know what you can do next time. And then you can come home and chat about it with other doctors and be like, I chose to do this. And they say, oh, that's really good. I'll do that as well. And a lot of it is just shared experiences because you're never going to be able to see everything. But, when you pick things up from other people, that's how you actually end up learning more.
Have you had students join you on night shifts?
I did actually. I had a really very good student. They were just, I think, reaching towards the end of their final year.
For man, we said you were never going to tell people about me.
You've been outed now, Richard, unfortunately. But yeah, so she was really keen to get involved and do a lot of the practical things because I think that's what she was most worried about on a night shift, not being able to do a cannula or not being able to, get the bloods when it was on an unwell patient. So we just sort of went through all that together. Everything was quite really useful for the student because they can just be supervised by yourselves. And then obviously you've got another pair of hands, and if anything is really bad, then of course you can escalate it as you would do. And it's just seeing that decision-making process when you're not directly responsible for it, I think really helps as a student.
Yeah, I really liked having students on when I did nights as an F1 because it means that they're kind of another pair of hands. They can help you do loads of the skills. And there's loads of, cannulas, catheters, blood taking and all those, ABGs or blood gas type tests and things like that their students really want to do, and that actually is really helpful for you if the students can do them. But also it's an opportunity, isn't it, for them to see more like unwell, the patients that you get bleeped to go and see are more likely to be a little bit unwell and might have some physical signs and things for the patient, for the students to learn from. So I think it's a really good learning opportunity to be on nights, but probably not the most popular thing for students, but I do think they're really good.
Yeah.
I think if you can try and do a few before you start, it will give you that boost of confidence. And it's also a really good chance to learn when there's not other students around. I find, if you're on ward round, you're tripping over each other, there's too many cooks, you've got lots of other allied health professionals, everything's quite busy because you're trying to get jobs done during the day. Whereas at 4 a.m, if you and I want to chat about acute severe asthma because we've just seen someone, I've got more time for teaching. If you say, I'm actually really worried about catheters, chances are we'll probably get one to go do
one,
and you're not having to sort of fight for attention.
I think there was one really good example that we had where people who were, because on an on-call, you are by definition going to see the patients who are more unwell anyway. So you end up seeing those like acute A to E scenarios that you sort of hear about at medical school. And there was a patient who had pyelonephritis, and even me, like I hadn't seen a pyelonephritis much at medical school. These patients can be really, really unwell, and prompt treatment and management. And so that became quite good for both me and for the final year to see, this is what we need to do, and this is how quickly we need to do it.
Yeah.
And it's so that, I think just the familiarity makes things a lot easier when you start work, because that I think is the hardest bit when you don't know what you're looking at.
Yeah, so Image just finished nights. So what's your plan for the rest of the day? Are you going to bed now, or are you staying up, or?
So I think there's like two schools of thought on this. So personally, I'm very pro nap. So I've just done 4 nights, so I would really like my bed. However, I can't go to sleep for the whole day or I'll still stay in Australian time. So
Yeah, the struggle is real.
yeah. So I tend to do like a maybe 2-3 hour nap. So I might nap from like 9 till 12, and then I make myself get up. So I normally plan something I have to be up for, like a shopping delivery, a haircut, meeting a friend, something that makes me leave my bed. And then you just sort of have to fight to stay awake the rest of the day. And then I try and make sure I'm in bed before midnight, because otherwise I get sort of the post-night zoomies, because my body's been used to being awake. So like a dog, I then
hear the bleep.
Yeah, I can hear it. I'm just so excited. So then I sort of flip my schedule back to how it was. But I know some people just sort of power through. I don't know what you do, Varun.
So I try and, like you, have a nap, and then whenever I get to sleep, or I just do some quite restful things to sort of just tire myself out a little bit later, and then maybe just get to about 1 or 2, and then just try and set an earlier alarm for the next day. And then even if it's sort of 9 o'clock or 10 o'clock, then that's fine.
Yeah.
And then from there, I can sort of get back into it. So it's slightly a bit more stilted. Yeah.
Well, I think we need to let Amy get back to her nap.
Yeah. So you've done very well being here. So
before
well done.
we finish this episode, I want to hear, what's your one tip if you were going to start doing your first run of nights now? What's one thing that you wish you'd known, or one thing that you would definitely recommend doing? Put it in our little box of wisdom.
Okay, it's going to be a bit rogue. Bring a jumper. I know that sounds quite strange.
A jumper?
A jumper.
Okay,
So
you need to elaborate.
Often in, whatever doctor's room, on-call rooms, that wherever you're camping in the hospital, it gets really cold because they put the aircon on, and I, for the life of me, can't work out how to turn it off. So I always take a jumper with me, just to throw on, especially if you're in a hospital where you have to walk between buildings. It's very handy to throw a hoodie on.
Okay, item number 1, jumper. It's in the box.
Jumper.
Varun?
Just have lots of food and water. I know it's a little bit of a boring one, but I think if you can just sort of let yourself just say, hey, look, I'm gonna have this much snacks, have a bar of chocolate, some energy drinks as well. I'm not like one who has lots and lots of cups of coffee, but just some energy drinks, and just whenever you want to have it, you can have it. On a night shift, anything goes. It's okay for you to have that.
Nice.
Yeah.
No holds barred.
No holds.
Yeah,
Exactly.
I think mine would probably be that. Treat the shift like a normal day shift. So if it's 8 till 8 night, then treat that like an 8 till 8 day in your head, and don't. That way you can actually do things after you finish nights and fit things in, like going for haircuts and that sort of stuff. Go and see your dentist or whatever the appointment is that you need to do. Get that done, and that way you're not just doing eat, sleep, work, repeat. Eat, sleep, work, repeat. So I think just treat
it keeps you sane.
Yeah,
and
it keeps you sane.
And also maybe just seeing your friends as well. You know, just before you go on a shift, like maybe 5-6 o'clock or something,
and having something to look forward to.
Exactly. Yeah.
Great. Okay.
Smashing.
I think that's it.
Lovely.
Thanks, guys.